let's talk about what the wellness dentistry techniques and procedure that both patients and medical professionals are looking for. First of all, our practice is mercury-free practice, which means we don't place mercury in daily procedure. We also mercury safe. Mercury-free and mercury safe are not the same. Mercury-free means you don't place it. Mercury safe means you remove it safely. So you can see, looking more into the technique and the requirement, both IMT and IBDM having the protocol listed on their website. But pretty much it's not just safe for the patient, but it's also safe for you, for your team, and for the environment. This is one of the example of cases when we do in the office. We always taking the before picture. We isolate the patient just like these pictures. And then in the mouth, we isolate the tooth, one clean rubber dam for each single tooth. And we're also taking x-ray after the mercury removed to make sure we get every little particle out, and then restore the tooth in a biomimetic way, which is preserve tooth structure as much as possible. And we always showing this to patient. We're sending this documentation to the medical office that refer the patient to us. And that's the reason why medical community understand what we do and why we do and how we do it. I got really sick, was suspected with autoimmune, suspected with a lot of different medical conditions that I'm like, I know I don't have it. I know something mysterious going on. And until one of the functional physician in Houston asking the question about mercury exposure, then when my test come back is such a high level of lead and mercury, and I have zero mercury filling in my mouth. And the conclusion was occupational exposure. When you find out that the patient have all these issues, right? The saliva that have a lot of pathogens, and the saliva test confirm that. We using the guided biofilm therapy, one of the part of the treatment, beside the dental ozone therapy, the laser therapy, we also use it guided biofilm therapy to help eliminate the biofilm and the pathogen. And of course, follow-up testing would tell us that if the patient respond well to the treatment. So remember, the traditional periodontal assessments and treatments are very disease focused. However, in wellness dentistry, we want to focus in health model, which means we screen with microscope, we test saliva, and we come up with the personalized game plan for the patient. And nothing is powerful than seeing what's going on in the mouth, and patient actually excited about getting the slide check every visit that they come in. My number one advice is starting wellness dentistry is asking questions. Asking about the sleep quality, asking about their nutrition, asking about their hydration. Yes, we do ask about their bowel movement. If your patients are not having regular bowel movement, their mouth is super acidic, and please, they're gonna blame everyone else for their cavity because they don't know why. Sometimes patients blaming other people for cavities. When we hear a mom say, oh, I get cavity when I get pregnant, or, oh, I get cavity because my genetic. It's because they don't understand why they had cavities. But if they understand and they have chance to improving that, then you the one that changing the world for them, because they try everything or they don't know why it's happened. And think about our patient having children. Now your influence and not just stop with the patient, it's extended to their family, extend to the community. And that alone, for me, is enough reason for you to implement wellness dentistry in your practice. It's really high return on investment because you're doing extra procedure, you're doing things that not many dentists offering right now. So patients gonna light up and trying to get into your practice as a patient. Therefore, you don't have to accepting insurance plan. Our practice is fee for service. We setting our fee based on our unit of time, not on what insurance company or what the zip code say you can charge.